We are very excited to partner with UTI and to be part of this global movement, actually, around healthcare improvements. So, with that, just a little bit of introduction about ourselves and where we came from and how we came about. So, I've been in healthcare for the last 14 years. In different avenues of healthcare, actually. I started my career in healthcare in business development in the hospital, working with the management of the hospital and, trying to identify how do we improve patient care, but how do we also generate revenues in order to close the gaps and deficit that we see a lot in the hospital system so that we can hire more nurses or we can nurture more services to the patients and have more beds, right? So from there, I've worked in the pharmaceutical industry around, new drug launches and commercialization. And my passion has always been around patients. How do we improve patient care? How do we provide new innovative diagnostics or technologies and services? So that kind of led me into Mars Discovery District. I'm sure many of you are familiar with Mars Discovery District, which is just down the road here. And I was heading up business development for one of the startups, which was in personalized medicine. It was completely very new field, genetics. How do we use genetics to better predict disease, your disease predisposition, to better understand what medications work for you and what medications are not effective for you. So this was a very, very new field. Now it is developing further. And so through my whole career in healthcare, it's all been around, the improvements we can bring into the healthcare. One thing I did learn while working in healthcare, that because we are in a very we are in a public healthcare environment, and we also have a private side to the healthcare, which is, insurance companies and some other type of alternative medicine and so on, that there's a lot of silos and a lot of sort of need to connect those silos to work together for the benefit of the patients, right? And with my experience in healthcare doing innovations, I've realized that one of the things that was missing for getting our innovations into the healthcare was a shift in the mindset, and a lot of that came about as I was doing, trying to promote innovation. I've realized unless we have an open mind, unless we as a industry embrace a change and understand that it's inevitable, there's many factors that drive the changes, technologies changes, science at the speed of light, actually. Science is really advancing. I mean, when I started doing genetics products commercialization 4 years ago, it was completely something different from where it is now. So with all that, we still face a lot of challenges, right, to bringing the innovations into our healthcare system. But so this is how I came about around focusing on driving the improvements through lean. And many of you have heard the word lean. So I wanted to see if you can put your hand up or just give me an idea of what is lean? Anybody? Sure.
Yeah, so it's like you learn along the way. You just try different things to learn new perspective along the way. This is my understanding.
Your understanding, okay. Try different things, like doing
new experiments, things like that.
Okay, all right. Anybody else? Yeah.
I think the idea is to reduce the waste that is involved in a process.
Yeah, in order to
improve outcomes.
Okay, great.
Satisfaction.
Thank you.
It's a system designed to identify system errors or things that are done wrong in order to optimize and maximize efficiency in the workspace.
Right. Okay, that's good.
Instead of a radical change, it's more of a conservative process where you continually keep what's good, and then leave out what's not working well.
Right. Okay, that's good. So all of these answers have elements, they're all correct, right? And this is why I came to a conclusion that we need lean system thinking in healthcare, is because it's about not doing radical change, which is a lot of times what we do with the innovation, but it's about how do we create a mindset of a continuous small improvements that anybody at any level in a healthcare organization can do, whether you're a frontline nurse or a senior manager or a scientist. And that kind of drives your thinking towards, okay, we're improving, and then you can move to bigger things, such as we need a new technology, or we can now think about innovating, right? If wanted to see, can you put your hand up? Who are the students here? Okay, so I think like 80% of the room are students. And who are people actually working in the field? Okay, so I would say 90-10, sort of 90% students, 10%. But I mean, you're all future of our healthcare system. So whatever the seed we can plant here today, we hope that you can take it with you to any place of work, right, in healthcare.
But Julia, are the students working somewhere?
Yeah, actually, great questions. Are you studying or working anywhere, or volunteering? Put your hand up. Are you working or volunteering as a student?
Perfect. So they are working.
So you are working. So you can be a change agent. You can be the lean practitioner in your organizations, and and of course, if you need our help, we're always here to help you, right? So
We will not ask Vanessa to see if she's working, because she works in 7 different places.
yeah,
Do you see what type of students?
what type of students?
What type of students? Are you guys graduate students, undergraduate students, medical students?
Yeah. So put up your hand. Are you medical students? Who is a medical student? Okay. And what other?
Graduate students? Okay, undergraduate. Awesome. And pharmacy students.
Oh, okay, great.
So we got a nice mix. Any other that want to share?
Do you want to share what other areas? Because medical, pharmacy, I understand. What other programs are you in? Anybody wants to share?
Social entrepreneurship.
Social entrepreneurship, yeah.
Well, undergraduate molecular genetics.
Molecular genetics. So you have someone to speak to in the room. Okay.
Medicine nurse graduate.
Nurse.
Nurse graduate. Okay, great. Oh,
Public health.
Public
public
health.
health. We're happy to have you in the room. Yeah. Okay. Anybody else?
Translational research.
Oh, yeah. That's an important area. Yeah.
Mix. Yeah.
Biomedical ethics.
Biomedical ethics. Yeah. Great. Yeah. Yeah.
Oh, medical lab technician.
Lab technician. Great. Definitely lots of lean. Anybody else? Okay, so that's great. So do you find are your key challenges? Put your hand up. What are some of your challenges in your work environment that you're facing, or others?
Lack of processes?
Lack of processes. Okay, you're in the right place. Anybody else?
Getting different stakeholder groups in the sector to collaborate with each other.
Very good.
Collaboration.
Yeah.
Inefficient use of time.
Inefficient use of time. Yeah, big one.
Before we ask the second one now, what is the biggest cost in Canada, North America? What's the biggest cost if you're running a business? What is your biggest line item?
Or for a hospital.
Cost. Where is the most of the money going?
People.
And when you talk about time, basically, money is going in the drain.
Okay. All right. So we hear your challenges. I mean, part of the lean system is to incorporate how to improve and how to get rid of those challenges that you've just described. These are all the different the sectors and where we work. So in healthcare, these are different clients of ours in healthcare. But we also put public sector because we work with different governments and different sectors of government. And it's not that much different actually from, working with people in healthcare. The business itself or what you're working on is different, but the challenges or lack of coordination, collaboration, or inefficiencies, or where you use your time and whether you use your time wisely is very similar, right? So these are just the ground rules for today. Speak freely and loud. I'm learning to speak louder. Have an open mind. Don't leave in silence. If you disagree with something or you have something to add, we're open here to discussion, and we're learning from you just like you're learning from us. So it's a two-way street. There is no such thing as dumb questions. So we are in an educational environment here, right? We might ask you some challenging questions, so hope you don't mind, and we're happy to get some challenging questions from you as well. You improve us that way as well, right? And if you don't mind, we've already started. We will take some pictures and some videos.
Not short, that's the whole video.
Yeah, that's right. Because we are a company. We do need to promote ourselves, and if you do like our sessions at the end, we're happy to. If word of mouth, right, works the best. If you know of an organization that needs lean services,
It will be on YouTube.
so you'll see us and yourself on YouTube. That's right. So this is our agenda for today, Introduction to Lean. This is a white belt. You will get certification at the end, but it's a white belt certification, which is the very beginner level of just a lean introduction, so you understand basics of lean principles. We'll do some group exercises, because that really, using practical ways of learning is the best way, right? So you'll do some exercises, and we'll share with you examples from healthcare of organizations that applied lean. Some of them worked with us, some of them are just examples of well-known institutions. So what is really lean, right? So I tried to kind of put this picture together because it's very familiar with people who are in healthcare, but really lean is a management philosophy. It's a system, it's a thinking system that has come from Toyota Production Manufacturing. And what this system does, and when it works effectively, it actually connects everybody in the organization. So it connects the purpose of the organization, why this organization exists, what are its main goal and focus, and it connects everyone in that organization. All the people are connected to that purpose, and then all the processes are aligned and designed around that purpose and connecting all the people. What you get as a result, what is the outcome when you have that in your company, is patient-centered care. And so another question back to you guys. It's a buzzword, patient-centered care. We hear it all the time, right? What is patient-centered care? What's your understanding of it?
Putting the needs of the patient first before other priorities.
Great. Do you want to write those down?
Yes, ma'am.
So, thank you. So putting needs of the patient first. Yeah.
So most often requires consulting directly, seeing what they need.
So actually, by putting their needs first, you need to understand what their needs are, not what we think their needs are, right? Incorporating patients' opinion and suggestions into the process, into a solution, right? Great, yeah.
Giving patient authority to actually share their personal information with doctor, physician, with the center of them.
So getting their consent to share their information, right? Okay.
Sort of like an ethical obligation, so if you make an error as a healthcare professional that might harm the patient but could also harm your career, to point out that you made the error, you should probably point out that you made the error anyways. It's a bit of a self-sacrificing responsibility.
Wow. So that's a noble
Hold that thought.
value. It's a great value to have, yeah.
Hold that thought for after. Yeah.
I think it's a transition from our attitude to saying, well, we've provided the best care we can, to we provided the best care we can to this specific patient considering their history and their medical record.
Right.
So not just dispensing a pill for a headache, but actually looking where this headache comes from, or is it like, how long has it been? Kind of like
So getting
giving the
holistic
best
view,
care,
yeah.
that you can individually, not just the best care that you can on the books.
Right. So you're looking at the human, at the person, and not just that medication you're dispensing, right? Yeah.
To add on to her point, this is something my supervisor said recently. She said that she started seeing her patients as more than an eyeball. She's an ophthalmologist. And that really changed her practice because now she was considering the family dynamic, the kind of needs of the patient first instead of just the disease. In itself.
Yeah.
So.
Yeah, that's great. That's what we're trying to create, the shift, right?
To
Yeah.
acknowledge the social determinants of healthcare. And
Yeah.
not just.
Because there's many things that impact why that person having whatever that issue they have, right? So, all right, one more.
Ensuring that even indirect processes that do not directly impact the patient, those while designed are kept in, like the patient's needs and cares are kept in mind even while designing or implementing indirect processes.
Right. Okay, great. So these are all great points. Yeah. So I'll give you an example, patient-centered care, just from a personal example. I'm sure a lot of you have personal examples too. My father just a month ago had ruptured appendix and with a high fever, so it was an emergency surgery. And they forgot, it was out of 100 other issues or hiccups that we had experienced, but they forgot to remove the the name just came out, the catheter, right? So during the surgery, they put the catheter in. They forgot to remove it. So the night goes by, the next day, he still got a catheter and he's trying, it's really uncomfortable, as you know, right? To have it for so long. It's been now 24 hours. So the problem was the doctor was not around because it was a surgeon and the surgeon was busy all day operating. And the nurse says, I'm sorry, I cannot make a decision unless the doctor allows me, right? So kind of, you're going to have to wait, which means wait another 10 hours, right? So speaking here from a patient-centered care, was this a patient-centered care, right? So not only you've increased the chance of the safety or infection by keeping catheter for so long, that's a huge patient safety issue, but you've also really not looking at a patient as a human, right? You're keeping somebody in an extremely uncomfortable position for something minor like this, leaving all the accountability for a doctor who's God knows where, right? So here's an example of our systems talking about patient-centered care, but I think we haven't come to that understanding what it really means. So this came from 8 Principles of Patient-Centered Care from the Institute, Pickers Institute, and this is kind of what they've described as patient-centered care. So respect for patients' preferences, something you guys talked about, coordination and integration of care. If we coordinated better my dad's care, the catheter would have been removed much sooner without the family having to nug them for a whole day. So information education, we want to make sure that patients are part of the decision making, that they're informed, that they understand the consequences and involved in the decision making. Physical comfort, we've got people already, patients, and a lot of discomfort. They're already in a difficult position, so that is extremely important, as well as the emotional support. And having, of course, family members being part of that process is extremely important. The big one I find is the access to care, right? If we just start from the basics, and we can at least figure out and work out how do we provide better access to care to people when they need it and what they need at the right time, at the right place. I think we can say we're really far, we moved far along if we can just get to that point. Okay, so what is Lean? We'll just quick overview video that give you an overview. Is it here or the next page? Oh.
Oh, go back.
Yeah. Just. Start volume.
Lean is a management philosophy derived from the Toyota production system, fostering a culture of continuous improvement, maximizing value and minimizing waste by focusing on a flow of high value added activities or processes. The key concept of Lean is the elimination of waste. Waste can be defined as anything that doesn't add value to the customer. an activity or process is only value added when three conditions are met. The activity must transform the product or service, the customer must be willing to pay for it, and it must be done correctly the first time. Lean is a culture of teamwork and continuous improvement, teaching people to identify and eliminate waste. This creates a more efficient process, in turn adding value. An important aspect of Lean is respect for people. This is a part of Lean leadership. Lean leaders motivate and coach people, helping them grow professionally and personally, and involve them in the improvement of the business. Lean is also sometimes seen as a set of tools or methods, such as value stream mapping, the 5 S's, and the Ishikawa diagram.
Okay. So any questions? As clear as mud? So yeah, it is a combination of a lot of things you were talking about. It is a system. It's not just a tool. You know, there's many tools in the Lean toolbox. But at the end of the day, if it's not looked at as a systems program where people are all working towards finding inefficiencies, eliminating waste from the value of the customer, which is a patient, you know, then it's very difficult to create a system that really works well and is efficient and provides high quality. So it is a systems thinking, and it's very broad. So these are the founders of this whole Lean. It's been around since early 20th century. It all started with, you know, time studies, motion studies, and standardization. And, you know, when Henry Ford was actually I would say, the founder of it, because they figured out how do we produce cars in the most efficient way, doing a mass production. But then in the 1940s, I guess, Toyota, Japan, sort of rebuilding itself post-World War II, discovered that, you know, there are scarce resources. They need to figure out a system to build up the economy. And so Taiichi Ohno, he's taken Henry Ford's learnings, and he really perfected it and improved it and turned it into this Toyota production philosophy management system that allowed Toyota, as you know, become one of the most successful companies in the world, with having the most efficient processes, high quality cars, and you know, very optimized from a cost perspective. You know that Japanese cars, when you look at the quality of Japanese cars, but you look at the price, you know, they're highly competitive in the pricing, right, globally. So. But they've moved, you know, Lean has been in manufacturing for years, but in the last 20, 30 years, it moved across many sectors. Now you see Lean everywhere, including healthcare. You'll see these are just some of the examples where it is in healthcare, but if you work in hospitals, many of the hospitals, even here in Toronto, such as UHN, North York General, and Trillium, and so on, they have Lean offices. So they actually have a department that has people like us or CJ that will be going out across the hospital and helping to drive these projects, big projects and process improvements across departments, right? Not just within one area. So the government of Saskatchewan and the Ministry of Health in Saskatchewan, they've embarked on Lean culture and implementation of process improvements using Lean about 20 years ago, and they've been using Lean for many years. It is not something, sometimes people tell me, oh, we've done Lean project, and I say, okay, and they say, well, we finished, we got some outcomes, improvements. I said, well, that's great, but it's a continuous. It's not something that you start and finish. It's not just a project, right? It's a continuous culture you're trying to build across everything that you do in your departments and organizations, so. This book, I don't know if any of you heard about this book, The Machine That Changed the World. Anybody heard about this book? You can look it up, but I mean, I haven't read it, but I heard about this book. But it was written by, you know, James Womack came from a professor at MIT. He was well-known systems engineer professor, and his book is very much in detail going about Toyota and how they implemented this Lean management system, and how it's going to be something that's going to be successful across the world for every sector and every industry. So it's an interesting book. So what are the ingredients of lean? So we talked about the culture, right? This is like a foundation, right? So you need to have a soil. You have to have a fertile soil if you're trying to grow, right? Something. So it's the same. If you're trying to create a culture of continuous improvements on an ongoing basis, you really need to build this foundation, right? So it all starts from culture, where people are valued. Because in any lean culture organization, if you go back to Toyota, the core principle is respect and valuing everybody, regardless what level you are at organization. So that's number one. Number two, one purpose and one focus, right? So you go back to one purpose, one focus. What is the purpose of Disney? What's Disney's main purpose? Yeah. Yeah. Entertainment? Okay. In order to do what? What's the purpose? Storytelling, but what's the, why are they doing this? Happiness. Great. So thank you. So they want to create happiness, right? She knew the answers. That's not fair. But that is their purpose, right? To make you happy when you go there. I don't know if anybody felt sad. We had all big smiles on our faces and everybody that you see there, right? So they're trying to do everything possible. Every single employee, everywhere you stop, somebody will greet you with a big smile, and they always want to make you happy, right? So that's their purpose. Another thing in healthcare is voice of a customer. So in Disney, it's, they're ear to the ground. What the customers are looking for. Are there any complaints? What can we do to make the experience and happiness even bigger so that they can get into your pockets even deeper, right? So this is, but the same here, but it's a different cause, but you got to listen to the patients. We talked before here, you have to include the needs of the patient, but you cannot know what the patient needs are unless you hear their voice and you bring them to the table. And the big one, which we're trying to improve in healthcare, or there's a lot of projects going on, which is we have to have accountability. So we need to have performance measures. If we don't know how we're doing, we'll never be able to know or if we're going the right direction or how we need to improve. So you got to have performance measures. And the big one, as we discussed, is you have to engage everyone at the organization when you do improvements, process improvements. So you have to engage your staff and connect them to that purpose and connect them to those performance measures so that everybody understands and aligns to what we're trying to improve. And when you have that foundation in the organization, what we call structure, if you create the right structure in the organization, starting with the right culture of valuing everybody and having respect as the core value, having one purpose, one focus, listening to your customers, patients, setting the right performance measures, engaging your staff and connecting them to that, you can now, what we call, use lean tools and start driving continuous process improvements. A lot of times, and CJ will talk about it, people start over here, they start doing continuous improvement and finding technology and finding innovation and finding solution, but it's only going to work if you have the right foundation and the right environment for it. I don't know if you heard of this, but when I was innovating and commercializing genetics diagnostic tests, I had to speak at a lot of conferences across Canada for insurance companies. And a lot of things that they talked about that in healthcare, we have tons and tons of pilots. We have lots of pilots. We have lots of grants and funds to do the pilots. But we're known as a country of pilots because once we finish those pilots, once we put our brain out there, we have another country or another region in the world that will take our knowledge and actually implement it in reality in the world, right? But, so we need to become more of that, not just the country of pilots, but the country of realistic, and people that are taking their pilots and implementing them, so. So meaning of lean, this is just talking about something that Health Quality Ontario put out. These are the criteria that they want to drive, in terms of quality of healthcare, which is around efficiency, making it equitable. So the cost is very important, making it timely, effective, and safe. So really, why lean in healthcare? When I think about what Health Quality Ontario and other organizations are trying to do, lean is has all those criteria that companies that use lean implement, right? A little bit, sorry for the slide, it was last minute, but a little bit about meaning of lean really is it's cutting fat and removing waste and any roadblocks or bottlenecks in the process. This is CJ's favorite picture, so I thought I'll leave it. But it doesn't mean you need to become so skinny that you cannot continue moving on. You just need to cut some fat if you have extra, right? So what happens, this was my visual of meaning of lean. 5 major types of renewable energy. You can do more with same resources, right? So that's really the goal of lean. So, we as humans have lots of energy. So how do we optimize us as humans that we are able to become more efficient and be able to do more, but in a more efficient way? So why lean in healthcare? I think we have enough just understanding of why you need this type of system in healthcare, but I thought I'll share a bit of statistics. This is the ranking that I picked up, and this is not too long ago. This is 2017. So Canada ranks 9th out of 11 Commonwealth countries. So you can see all the countries there. And this was done based on criteria, care process, access, administrative efficiency, equity, and healthcare outcomes. So, we're not the last. You can see who the last is, but we're very close to being there, right? So we really, on a global scale, a lot of times people look up to Canada saying, oh, wow, you have a public universal healthcare. Wow, it is amazing that we are able to have it. But if you think about it, if we continue this way, are we going to be able to continue with our universal care, right? And we do want it. We want it for future of our children, but we have to do something drastic about it. Access to care, I thought this is a big problem. I actually think numbers are even higher, but this is a percentage of people in Canada by age without having a regular doctor. You see people going to walk-in clinics. Today it's this walk-in clinic, tomorrow they're in a completely different one. The two don't talk. Somebody prescribed you the drug that somebody else is going to prescribe the same drug to you, and you'll be taking both without realizing it's the same one because they have 2 different names. So this is happening all the time, right? So this is really sad. And actually, those countries, they're that were at the top high performance. If you read about Germany, UK, and some of these countries, some of the fundamentals that they focus on are access to care. They make sure that every single individual in their country has a physician. So those things are extremely important. I pulled this up from one of the hospital reports. This is public information. What amazes me is that it's public, so everybody can see it, but I talk to South Lake Hospital once in a while because I'm working with them on trying to do some innovation there. They're the last ones on the list, 148 days waiting for surgery. It's a tough one, but when I asked them about what do they do about improving these scores, sounds like, it's like mashed, they kind of throw, this department is doing something or that department, but there is no real plan. So this is why we're talking about lean, because it is a systems thinking about how to drive improvements. So we're going through chapters, right? And so the first chapter of lean we talked about was culture, that it's extremely important to have the right culture to be able to create continuous improvement. So give me an example of what does culture mean to you in the organization? Anybody? Yeah. Diversity. Okay.
Nice to see people from different backgrounds that might bring their set of mind and maybe help you solve the problem, maybe more approachable. And there's oftentimes language barriers for patients to come in. So if you have people who speak your language or have translational aid from the hospital, it's very helpful. And
That's great. Actually, yeah, they do speak about that for innovation, actually, the more diverse, you do need diversity in order to strive and get the innovation successful. The more different perspectives you get, the better. Yeah.
But I'm sorry, you don't just mean different caste, different religion. You also mean having the nurse, having the doctor, having the technician all together
Yes.
for problem
Different
solving
perspectives.
and different cultures.
And different cultures and different perspectives. Yeah.
Perception of strong social community.
Elaborate on?
If you're in an organization, if everyone kind of has the perception that they're all part of the same objective, all have the same aims, there's sort of a strong, more positive engagement between all members.
Okay, so one focus.
One purpose.
One purpose, yeah.
From my experience in workplaces, Canadian workplaces, there's this shared goal, like this we're all in this together attitude that just doesn't exist. People are very individualistically tasked, and if you're a call center representative and a technician says, oh, don't book me like this or don't book me like that, you go like, oh, you're just a technician. What do you know about my role in the company, right? So, and that's it's so frustrating. It's this low effort, underachievement attitude of like, it's not broken, then we don't need to fix
Yeah.
it. We've been doing this for years, it works.
Which is, they're not connecting. They're really not connecting to the goal
to
and
the-
a one purpose, which is something you brought up. Somebody you're working with, right? Once was ophthalmology, ophthalmology, right? So once the main physician realized that she's looking at the person and not just the eyeball, her whole practice changed, right? And hopefully her people around started changing too, because they see how she's behaving different and thinking differently. So, sorry, you had your hand up. Oh, okay. Yeah.
Individual rights and responsibilities. So sometimes you should expect workers to assume their responsibilities before they are entitled to certain rights. So, yeah, obligations on an individual level as well as a collective level.
Right. So, just trying to understand the.
What he's trying to say is that I'm working for you. I should have that accountability that I have to do some stuff also, not all the time throw at you. You fix it.
Right.
I have
You have
responsibility. I have accountability. I have to do 65 patients a day.
Yeah.
So I have a quick question about that. So when we're talking about culture, we're talking about developing this collaborative environment of multiple and diverse backgrounds. How do we create that accountability when there's too many cooks in the kitchen?
Yeah.
Because sometimes what happens, people, when there's not one, leader or someone to kind of make sure that all the pieces fit together, then people will say, oh, they can do it. It's not on me. So how do we create that accountability?
So there's
That's my chapter.
Yeah, and there's lean, and then there's the behavioral change, which of course it's very important that there is a leader, and that's if there is no one leader, that's why people like us come in. Because if you do have a strong leader, you don't really need, somebody else to come and align you to that. But everybody comes, especially different backgrounds and diversity and education, everything. You have to, as an organization, define that one purpose and focus as a team. And then you have to define the values. What are the values that are important for us as this organization? And then everybody has their own values. But if they're part of that system, you need to have that actual discussion and team meetings discussing each of those values. What does accountability mean to you? What does it mean to you? What does it mean to you? And you do need, and that's how you create that collaborative environment, through those sessions, through those discussions, through coming to that agreement. We may not always all agree that this value, I may see this value differently than you see it, but at the end of the day, we all have to align as an organization, right? So,
Julia, to answer to your question, very simple. Yesterday, we are working in a manufacturing plant. So please do not think that you guys have different issues. Healthcare. You guys have same issues like all the sectors. Ditto. Maybe you guys have more seriousness when it comes to the death patient. We agree on that. So yesterday we were working with a production manager, and we were talking about who checks all the parts before the production starts. I check. Production manager said. And the material guy, the material manager was standing right there. It showed me there is no clear roles and responsibility. Oh, we get it done. No. Clear roles and responsibility has to be clear in the organization. You are responsible for A, B, C. You are responsible for D, E, F. And that doesn't happen. And we have seen in healthcare sector also.
And then the collaboration needs to happen, right? You have to communicate.
I think on the other end, it is also very important that when you're working in like these type of environments, I'm not saying that a doctor should do a nurse's job and a nurse should do a doctor's job, but if you have a person doing ABC and a person doing E, D, F, or whatever, they still need to have the knowledge. So if that person who's doing ABC cannot do his C's or cannot do his B's, you can back them up. So like where there's vacuum, the team will come together to seal it, and then things won't fall between the cracks.
This is called multi-skilling.
So this is actually, so you should listen to the next video that I have. It will speak to something that you're described right now. Actually, perfect lead into this next section. Thank you. Actually, it's the next slide, but this is kind of evolution of healthcare culture. I wanted to bring that up because where we are now, where we need to be, this is kind of what it does. So current culture of healthcare, it's physician-patient relationship, right? It has always been that the physician has the full authority, to decide, to advise the patient and so on, and all other healthcare professionals are there to support, but at the end of the day, it's patient-physician relationship, right? Which is kind of a bit of a past because things are changing, right? So we have advances in science and technology, and you don't have right now this one family physician that knows it all. You have tons of specialists. Each area is so developing that, there's like 100 new tests coming out like every year that, your doctor is not capable of keeping track of all that. So that has become, that we need to change the mindset. It's not just this one physician with the patient relationship, right? Things change. Healthcare has become a business. It's, it's unfortunate that it is a business because I think number one, healthcare is about, keeping patient alive, giving them good quality of life.
But Julia, how many people agree healthcare has become a business? More than 80%.
So I think we're all aligned, more or less.
Seen it.
Yeah, and we have seen it because we work not just with hospitals, we work with privately run clinics, and we're under NDA and privacy and disclosure, non-disclosure, but we've seen things that should not be happening in healthcare. Maybe in other type of businesses, but not in healthcare. So those are some of the things, right? If you look at trends of emerging culture, what needs to happen, like you hear this multidisciplinary team approach, right? Because you cannot just expect one doctor having full accountability. They're also humans. They can make mistakes. There's medical errors and all kinds of medication errors that happen, and you cannot have a blame on just one individual because that's a doctor. That's why you need to have this team-based mentality, team-based approach where, you need to understand the other person's job and all the things so that you can complement and help each other, right? And support each other. So it's extremely important. And now we have this Dr. Google, right? We're all like kind of our own doctors. I go and diagnose myself, my kids, my husband, and everybody around me before they even go to the doctor.
She did to me too. I have a back issue. She killed me. I'm just telling you what can happen.
I think I scared him before.
I was okay. By listening to her, I had 2 days more I was on bed.
But we're talking about alternative medicine, so I always say you can't just think about opioids when you go there, they'll drug you, which you'll enjoy for a while and may ask for more. But but you have to remember that's not a way to solve your back issue, right? So there's he went for acupuncture and did some other things that you need to consider. So anyways, those are the different changes. So that's why we need to be thinking about the culture. It's extremely important because we cannot be continuing in this siloed culture. My responsibilities are this, the roles, responsibilities are extremely important, so you don't have confusion, but we need to be thinking how we're coordinating with others.
Julia, just to add, because you guys are learning Toyota production system, I have to bring cars in. I'm a manufacturing engineer, so I have to bring. When Toyota manufactures cars, there is weld shop, there is paint shop, there is electronics department, there is engine department. What is the end result they are all looking for together? A car. A one good car.
Working car.
A one good working car. And what we have seen in healthcare system, this specialist is giving these medicine, these specialist is giving these medicine, this specialist doesn't know what this is happening, and at the end of the day, chemical, what you call reactions and
Adverse drug effects.
The car is not a car anymore.
Yeah, I actually always wonder, this is one of this lifetime thing that I'm trying to understand is how cars, we all do regular maintenance, oil change of a car, we even get reminded to do that, and things like that. Meanwhile, we as humans go through life and, we have healthcare supposedly, which I think it's more of a sick care because we don't do oil change. I mean, what do we do as our bodies continue to get older, just like any car? What do we do to maintain our bodies? So some of us may be looking into that through naturopathic or other ways, or exercising and diets, but most of the people just go through life without that maintenance. So this is the video.
A nurse on the night shift in a busy urban hospital notices that the dosage for a particular patient seems a bit high. Fleetingly, she considers calling the doctor at home to check the order. Just as fleetingly, she recalls his disparaging comments about her abilities last time she called him at home. All but certain the dose is in fact fine. The patient is, after all, on an experimental protocol which justifies the high dose. She heads for the cart, gets the med, and goes toward the patient's bed. I joined a team of mostly physicians and nurses, and the job of that team was to find out, to assess, they hoped conclusively, what the actual rate of medication errors was in, let's say, some modern tertiary care hospitals. So their job was to set out to collect data on drug errors, human-related drug errors. My little part was very simple. I was going to ask the question and answer the question of, do better hospital patient care teams make fewer mistakes? I used a standard team survey measure to assess the team effectiveness, and trained nurse investigators visited a number of units in 2 hospitals every couple of days for 6 months. These were the data that they came up with. Now these are adverse drug events, errors, just called medication errors, that were deemed to be based on human error, expressed in terms of errors per 1,000 patient days. Now, here's where the story gets a little weird. I got the data, waited patiently, I got the data on the teams, I got the data on the errors, and I ran my analyses. And what did I find? The results were exactly the opposite of what I had expected. It appeared that better teams were making more mistakes, not fewer. Now, from the point of view of a young researcher wanting to publish a paper, this was a real problem. Never mind the other problem. So what did I do? I sent out a young research assistant to study these units very carefully. He had to have no preconceptions. He didn't know the error rates. He didn't know how they scored on the team survey. He didn't even know my hypothesis. And I said, what do you learn? And you know what he found? He found that these units, these 8 units, were wildly different in terms of whether they were willing and able and did, in fact, talk about errors. Some of them were actually actively talking about them all the time and in the process of trying together to work together to find new ways of reducing them. I called this much later, I called this psychological safety. Now you might want to know, what was the sorting rule in this chart? It looked at first like I was trying to get it from highest error rate to lowest, and I just not very good at math and got mixed up in the middle. No. These are sorted by the research assistant's ratings of the openness of the climate.
So I didn't want to show, it's a long video, but basically what they found was that the teams that are operating as a high-performing teams where they do talk a lot and share the information, they find more errors, right? So the reason that you look at the ones that have fewer errors is because nobody knows that there are errors, right? So that's kind of goes back to, are we working in siloed? Are we working as a team, trying to make the improvement for providing best patient care, right? So what she calls this team psychological safety, I don't want to go into this whole psychology and aspect of things, but I will a little bit, is that, you know from environments that you work in and you experience, is that if you as a team member feel safe, that you can share and you can be open around, identifying problems and issues, then you will be operating in a culture where you will be finding errors, you will be finding lots of defects, but you will also be working in a place where you'll be continuously improving as a team because you feel comfortable sharing and relying on each other and supporting each other. So that's kind of where this goes, that's psychological safety, or how the teams form and feel about working together, forms, how good is our patient care.
So Julia, just to add again, I'm here to make sure she doesn't forget Toyota. I'm keeping you guys in check. So in Toyota, it's okay to make a mistake. It's okay to talk about mistake. As long as we are not making the same mistake over and over and again, it's okay to fail. And we work in all the sectors like I told you. And yes, it's a taboo to talk about problems. Oh, when you talk about problem, that means I'm talking about you. In Toyota, we are talking about the problem. It's in the middle of the table. It's not sitting at the chairs. If a problem occurred, Toyota believes there is an underlying root cause in your system, in your process, which allowed it to happen. In other sectors, generally it's her mistake, it's his mistake, it's his mistake. No, Toyota doesn't believe in that. Toyota believes your system has an issue. And that it's a total different mindset. And I think healthcare is going through, lots of hospitals are going through it, that it's okay to talk about mistakes, because when you hide, that means you will never talk about it. The root cause is not found. It will happen again.
And it goes back to why we're having difficulty, why we're a country of pilots and we have a hard time commercializing new things and innovating. On top of all we have regulatory issues and that are being worked through. But we're thinking, our thinking is status quo, because a lot of times you come into the organizations and companies I worked with, and there's a fear factor. There's a fear factor when everybody around you does not look at change and is operating a status quo. What ain't broken doesn't need to be fixed, right? So the old saying, they don't want to be the one kind of, standing out and being different from the pack, right? Like I've talked to a lot of organizations that have these roles called Chief Innovation Officer. Sounds glamorous, but at the end of the day, what can Chief Innovation Officer do in the organization if organization is not ready to innovate? So, and that's what happens when you come out, you come from Mars, as I used to say, where did you come from Mars? And I did, for Mars Discovery District, and you're trying to pitch this new innovative idea on how it's going to help them and improve their costs and this and that and value and keeping employees more healthy and attentive at work and so on. They looked at us thinking, yeah, but there's so much risk. And if I take this project on, my job is on the line, right? So those are the type of things that people are afraid of, which is we call, psychological safety. So I love this quote. We're not a team because we work together. We are a team because we respect, trust, and care for each other. So again, it goes back to Toyota philosophy, which is the core value of a culture of Toyota is respect and value people. So that kind of goes back to what does it mean? What does it mean for us in the healthcare sector, right? No hierarchy, right? Anybody on a healthcare team should be able to speak up. Doctor, nurse, administrator, lab technician, anybody should be able to speak up. Because why? Because they're all there for the same purpose. They're there to make this patient better. right? And address patients' needs. So that's kind of the thinking or the mind shift that needs to happen. I mean, we certainly want to have one of our courses in the long term as part of medical school curriculum. I think these things need to start at the seed, plant them, at the grounds when people are still open-minded and then taking in all this new information. But no hierarchy is key. Everyone in the organization is treated equal, right? It's not about comparing paychecks. It's about, providing value to the patient. Climate of trust, openness, and safety.
So, Julia, before you go further, how many people have heard about word servant leadership? No one.
No, there's a gentleman over there.
1, 2, 3 people out of 80, 70 people here. Do you know what's the meaning? Can you explain, sir? What's the meaning of servant leadership? What does it sound like?
What comes to mind?
It's this concept of basically, it's this concept of effectively serving the people that you lead in order to make them better, so that they can do their job more effectively.
Very, very nicely said. It's a very simple philosophy, and it's a beautiful upcoming field. I want you to Google whenever you guys love to study. This is your right time. Please learn about these things. Toyota believes in servant leader. I'm a Sikh, by religion, and I used to run Honda assembly lines. I was senior manufacturing engineer. What do you think my role was? Just to tell people, let's make 100 cars. That's the leadership part. After that, I had to be with them, fixing, rolling up my sleeves and fixing all the issues the whole day. By the end of the day, my turban was twisted, my beard would be open. We are talking about India, 47 degrees Celsius, 95% humidity, that's what you get. But that's what I was trained as. My position was kaput, didn't mean anything. I was the servant for my people. Please remember that, if you can, please.
Yeah, and we do see in those organizations where the leader steps down from that nice office into the weeds, and works with the people and talks to the people, it makes a huge difference. Right? So again, I'm not going to repeat, we've talked about this, but basically high-performing teams can do wonders. So embracing lean culture, again, this kind of tying everything together. You're trying to bring everyone together, whether it's middle management, senior management of hospital, physicians, frontline leaders. Without that teamwork, we're not going to be able to create major improvements, breakthroughs, bringing science from the science into the real world, and so on. So we've talked about the culture. I think purpose is something we've discussed, which is we need to figure out, what is the core purpose of organization. I think this was kind of the last night kind of visual, but what this kind of shows how many organizations, whether it's in hospitals or whether it's any industry, a lot of organizations or corporations, they're not sure what their purpose is. They're still trying to figure it out. So they kind of, go in different directions, and hopefully, the successful ones or the good ones, they figure it out. But a lot of them kind of wander there, right? And
Julia, let's talk some examples. We talked about Disney. What's the purpose? Happiness, smiles. That's it. And I've been there 3 times with my kids, and I see it. I feel it personally. I'm working with a collision shop. Collision shop means when you get into a fender bender, you go to the collision shop. He owns 7 collision shops. Do you know what his purpose is? I fix your cars like it's mine. That's it. So purpose doesn't have to be a flashy thing which you have to go on a retreat and come out with a page and a manual. A purpose has to be a very simple thing which can connect your employees' hearts. Okay? Have you guys seen the movie Avatar? Avatar? Old movie now. But in that scene, he says, this is our land. The whole Nabi population gets together and fights the human. That's what we mean by purpose. Simple, which can connect to people's heart. And don't keep it tucked away in the folder somewhere. It should always be visual. So anybody has any purpose in mind, which you have seen and you love it, whether in your job, whether you were going on the road, whether you were looking at Apple or BlackBerry, anything. that you connect with quickly? Any example? Any organization or a brand you see and you say, wow, what a purpose.
Tesla,
Tesla, what's the purpose?
to accelerate the transition to sustainable transport.
Perfect. You connect with it, right? You will love to work for Tesla also if you get a chance.
Sure.
Yeah, right? That's what I mean, that you quickly connect with it. Anybody else? Any organization, any brand which stands out to your mind?
So I worked at a biopharmaceutical company called Sanofi Pasteur, and their kind of thing was like having a world where vaccine preventable diseases, people have access to all the vaccines needed, and no one dies because of vaccine preventable disease.
Beautiful. That connects to your heart. You don't have to now worry about anything. You will come in every day, and if that purpose is every day in your forefront, you will keep on working. That's what I mean by purpose.
So we're going to show you a purpose of this hospital, Virginia Mason in Seattle.
What is this one?
Virginia Mason. It's a large hospital that is what we call Temple of Lean. They've been using Lean at every level organization, and they bring their staff to Japan. They have Japanese Toyota people come to their hospital, and this is an ongoing process of culture of Lean that they've created. When you see their video that we'll do later, at the top for them, their purpose is patient. Everyone in that organization you talk to, from every level, frontline administrator to the lab technician to the CEO, they talk about patients. Even lab technicians talks about, when I do these samples, when I look at this, I don't think of how I need to get the samples processed and so on. I think about, this is a human life. This is a patient. This is been engraved in their head, which is, created that collaborative team environment where that's kind of their purpose, and so they work towards it, and it shows from what the patients are saying and the experiences patients are having in that hospital. So it did completely reshaped their practice and their hospital.
Somebody said that in the morning.
Patient first, yeah. And these are some of the words that I picked up right from that video. Treat patients as family. Everyone there that they interviewed, they say that. They just like with cars examples. You treat somebody who comes through the door like it was your mother or your family. Just like fixing the car. It's like if it was my car, I'd be making sure to take a good care of that, right? So, total patient care, and they talk about total patient care from like janitor to the doctor, right? So their janitors think about, patient care. So anyways, they think of patients in everything they do. That's the hospital. It's a quite large hospital, 5,000 employees. Those are their key principles. And again, it's visual is also important, talking about these things and people seeing them. But patient first is the driver of everything they do, right? That's their slogan, patient first. They create that environment where people actually feel safe to engage in improvements. So if you see need for something to change, people are not afraid and they speak up. They have a company-wide defect alert system. We won't go into the details, but basically the patient safety is number one. So if anybody anywhere sees something that could potentially have an issue for patient safety, it gets brought up.
So, do you guys know about the visual system in Toyota? When there is an issue, you can stop the line. Have you heard about this? If you have an issue on an assembly line, you can press a button and light goes on. That's what they have taken from Toyota Japan. Anytime they have an issue, they can press the button. They can stop that process right then and there, and a SWAT team comes in and looks at the root cause and they fix it. And they don't fix it for today, they fix it for life. That's the goal. So please remember, in Japanese it's called and-on system. The chief of this hospital picked up that from Toyota Japan, and he has applied in the hospital.
Because how many times that people talk about problems? You go to these meetings and they talk and talk and talk and talk, but when do they actually happen to make any change, right? So this is the system that Virginia Mason have picked up on. So accountable leadership. Everybody in the organization is a leader and everybody is accountable, right? Regardless what level you're at.
Julia, before you move further, so guys, do you see some of the points that you have been discussing It lives in Toyota Production System. It's a culture. So please remember, Lean is not a set of tools. Lean is a way of thinking. Lean is a culture. That's why all the hospitals are jumping on Lean.
So I'm just looking at the time, but this, and then we'll have a break right after this, right? So
Once you give it to me.
Okay. Voice of a patient. So, voice of a patient, as we discussed, we talked about the culture, we talked about the purpose. We really need to address patient needs. So, we need to know what their needs are, meaning we need to actually talk to them and ask them, right? What does patient want? We have discussed this morning things that patient want.
Not in depth.
Sorry?
Not in depth.
Not in depth. Okay. So, let's go into more depth in terms of what is patient looking for when they're getting healthcare.
First thing, what are they looking for? Number one,
Solve their issue,
solve their issue
for which they're there for.
to the root cause.
So he was.
Yeah, you had your hand.
You
first.
had your hand.
Same.
He said it. You guys are telepathic, okay?
Time.
Time meaning.
So when I go see the doctor, I want them to focus on me, and I don't want to feel rushed. I think a lot of times with, family physicians, if they want to decrease wait times, they tend to say, okay, like, what's the problem? Let's get you out of here, kind of thing.
Okay, let's do this. I'm teaching you also how to use everybody in the room's knowledge. Find a partner, talk to each other for 2 minutes, and write down what. Talk to each other. Very important for you to take away. Voice of the patient. 2 minutes.
Kind of knows like this stuff.
Let's quickly take it up. So let's have one or two teams share with us what you came up with. Anybody? Okay. Yeah.
Wayfinding, easy access when you first get into a hospital.
Easy access.
Access to people and information.
Access to people, information, and probably physical access. Like, where the heck is that place? Going through all the floors. Yeah.
We said trust. So you need to be trusting in us that we know what we're doing. And by doing, to do that is create some empathy.
Sort of establishing a collaborative environment on all levels, including the patient, not just the physicians and the nurses.
Yeah. So patient's voice is part of being heard.
I know that the point has been brought up that there should be more time given between the.
What they do is they talk to the doctor, they write it on a piece of paper, and then they spend 2 hours to type it in. And then we were talking, my doctor is talking to me and typing. But then somebody said, oh no, he's not being attentive. Right? He's not looking me in the eye. So my question is back to you. What would you guys prefer? How do you find that balance? Because that's a big challenge. There are effective doctors, but their patients say, he doesn't look me in the eye. He's just typing. So how do you play with it?
I think these are acquired skills that you can learn in terms of not just the way you communicate, how you convey a message, but also kind of like getting a first impression of the person you're sitting with. Where are they in the space? Are they looking at their watch? Are they edgy? Are they fidgeting? Are they worried? Are they sweating? Like, who is that person that you're talking to? I really like my physician. She's a sweetheart. I sometimes want to save her time, so I go like, just briefly, just write me that thing and I'll be out of your hair. And she always says, I'm here for you. This is your time. This is not my time.
Yeah, but I like her point. It has to be a balance.
And
It's very
she
important.
says, and she would say, excuse me, I'm just gonna type this really quick here.
Yeah.
But she knows me and I know her, so that's fine. Maybe with other patients, she will type it later.
But her point is, we still have to, sorry to use the word, we still have to get those patients out. They still have to manufacture. You still have to produce also. Sorry to use the word manufacture, but you have to. That's why we have a backlog. If you cannot reduce that time, how do you see this huge backlog? Last part.
Well, just to add, that I think the most of time waste isn't in the clinics when people wait to be seen by doctors. It's in the external support system, labs, specialists, referrals. To give an example that I already said today, a friend of mine was recently received her diagnosis, and unfortunately it's not a good diagnosis. The thing is that the lab results were in the clinic for 10 months. And this is the kind of diagnosis where 10 months could mean the difference between
Life and death.
exactly.
That sucks.
And when they started investigating, the doctor pointed to the lab, who pointed to the nurse, who pointed to the specialist, who pointed to the driver, who pointed to the marking system and the stickers, but nobody is at fault.
When you're in a hospital, it feels like you've got this big machine, but you don't know who's responsible for what. And every time you ask, you're being pushed here and there and there and there. But there's no one really, responsible or accountable. If I come to a car dealership, and I don't know what's happening with my car, they will have somebody who will gather the information and know what's happening with my car, right? So here's another comparison.
She doesn't drive a Toyota, by the way. So bad. No Japanese car
neither is he.
No, I have a Honda.
So, the one thing I find, though, it's still missing the accountability piece. I'm still yet to try to understand but I think what they try to do, they're trying to work on developing performance measures, and that's the key. How do you drive accountability? You can drive it through having the right performance measures, and then everybody in the system has to follow or abide by those measures, right? That's maybe the flaw in the system that we've had for years. This is some of the healthcare data, which is kind of scary. Access to care, 57%. So this is kind of what is the current experience of patients. We're talking about voice of a patient. What are the patients experiencing now? 57% of Ontarians cannot see primary care provider the same day or next day when they're sick. So we've got a sick care where we all go to walk-in clinics and have big lineups in walk-in clinics. 52% find it difficult to access care in the evenings or weekends. So I guess we still do not have a system that allows us to be able to consult it by a doctor off hours, right? I actually find it amusing because I was traveling and I was in Ukraine, in Eastern Europe, and it was evening, and my friend, she stepped improperly and her foot was kind of swell. And it was evening time. They have this call, like this number you call. There's a nurse to triage you. There's a doctor. There's a place where you can go to get the medication. So, you go to these other places in the world and they're not necessarily, they're sort of considered third world countries. But sometimes it's amusing how you can get an instant care when you need it and what you need. So, and so we still have tons and tons of, as a result, patients going through emergency room because they don't have a physician. I've seen patients at Sick Kids and other hospitals where they're walking through ER and they're there for, I don't know, like headache, like nosebleed, you name it. And when you try to find out, like, why are you in the emergency? They're like, oh, I don't know. I don't have a physician. I didn't know where to go. It happens all the time. It's actually pretty amazing. Yeah.
So do you think that there should also be a greater onus on the patient and kind of increased awareness of what is an emergency situation, what is appropriate, I guess, a condition to go to the emergency room versus like what can wait a little bit? Because I think that's another issue as well. It's not just like the wait times. Yes, there's problems within the system, but maybe there's problems on our end as well, and kind of how we understand emergency.
Yeah.
For sure there's one, but I think, again, I'm going to go back to the systems problem. If we, and I may not be the most liberal person in the room, but if we had a system where we had to pay a small, what do they call it? They have it in Israel. The fee.
Yeah.
You have to pay a small fee. It doesn't have to be big to go into emergency room or to go to like this physician like 10 times a day. Maybe you would think twice, am I really having a real issue to go into emergency, or can this wait? Or how do I find out about other supporting, areas where I can go and get help?
Just to speak on that, I know at Sick Kids I'm about to work on a quality improvement project where we're going to give out not surveys, but like sheets of paper that list off for the kids, like if your kid has a headache and then what temperatures actually need to be an emergency. Like, so we're gonna see if giving out just an information sheet to the parents waiting in emergency rooms, if that helps them either go find different, like healthcare, like we're gonna provide even where there's doctors or walk-in clinics that are not emergency room, just so we can decrease emergency wait times. So we're about to set up-
unnecessary emergency
So-
visits, yeah.
So speaking on that, I don't think it's the patient's fault, but I think if the hospital can even just provide a sheet of what they're looking for in emergency, so we're gonna see if that actually helps, so.
And just to add to your point, well, again, I'm not from healthcare, as you can tell. But it's good to have that eyeball. Lots of hospitals have put down nurse practitioners or doctors right at the triage, so they can filter. You came for medicine, go. Don't go into the system. So there are very simple solutions, but again, it takes somebody sitting here to say that we are ready to make. Once you apply lean, and I hope you guys all become lean professionals, at least in your mind, the solutions are so simple. It's just we don't focus. I can share tons of case studies from healthcare, outside of healthcare. The solution was like, just move this from here to here, and it reduced the waiting times. So please keep that thought. That's why you are here. You guys are the future. I hope you guys will challenge this and change this.
So these were just stats I wanted to share with you. I mean, the scary part is our wait times for surgeries. They've gone up to 21 weeks wait time from 6 or whatever that was, 9 weeks in 1993. That speaks of something is wrong with the system if we're just keep on going up. Adverse side effects, again, we talked about it. If we go to 100, I go to 3 doctors, 1 specialist, one family physician, another specialist, and I end up taking a mixture of these medications. And thanks to personalized medicine and some drug compatibility testing that exists in the market now, you can at least start preventing or reducing some of those exposures. I worked with insurance industry a lot. Actually, statistics come from one of the largest pharmacy benefits management company, Express Scripts, but we waste $1 out of 3 in medication spend, in drug spend in this country, $1 out of 3. I wonder what percentage of that makes up opioid overprescribing, if not the whole dollar. But so those are some of unfortunate statistics. I think this slide was already there. I'm not sure, but this is kind of voice of a patient, what patient is looking for, right? We have our current state of what patients are experiencing. At the end of the day, they want to experience this. So with that in mind, I think we're at the end of the first section. Your picture. So I'm going back. Actually, this is the last slide of this section, voice of a patient. But if you remember that picture I was showing you, evolution of healthcare culture, as based on everything that we see, and we need to redesign the system, right? And how do you redesign the system? You need to start from basics. You need to start with things like, we're all here to serve the patient, and therefore that culture of working as a team becomes extremely, extremely important.